Hi guys, I'm Kaylin.
I'm Ryan.
And I'm Julie.
And this is our TENS unit video.
Hi, I'm Julie, and we are doing a project in our modalities class related to TENS units for at-home pain relief, and simply TENS stands for transcutaneous electrical nerve stimulation, which simply means on the surface of the skin. So, as clinicians, we are not trying to stimulate or activate muscles for a full contraction. Instead, clinicians are utilizing TENS units according to the gate theory for acute pain, which simply means masking that pain. So only buzzing or tingling sensation should be felt per that sensory level stimulation, and it should be strong but tolerable or strong but comfortable in that sensation. For the acute pain, we're utilizing a higher frequency to stop the pain spasm cycle. We are using a low or short pulse duration, so the treatment is more tolerable and comfortable for the patient. And for chronic pain, we utilize a lower frequency and a higher duration, which relates to what's called endogenous opiate release for chronic pain, which is essentially pounding out those endorphins to break up the pain spasm cycle. And we use a motor level, which we are looking for a muscle twitch in this case. So we essentially turn up the intensity until we see that muscle twitch, and then if we need to, we can instruct our patient to back it off if it's more comfortable for them, so within patient tolerance for acute and chronic pain. We have what's called brief intense TENS, which utilizes a higher frequency, high duration sensory level stimulation. With TENS units specifically, we like to educate our patients that they can do this 2 to 3 times a day for up to 1 hour per day. And then we will be going through TENS for low back pain specifically, which will use 2 channels and 4 electrodes, particularly the 2x4 rectangular electrodes, and we'll tell you more about that. We are using a TENS portable stimulator, which allows the patient to relieve pain between their PT sessions for greater patient tolerance and functional mobility. So that is for the greater patient tolerance and functional mobility, and then that will help break up that pain spasm cycle. And then before we apply any electrodes to a patient, of course, we need to make sure that they meet the requirements and clear the contraindications for treatment, because we don't want to be setting up this treatment if they have any of the following conditions. So those contraindications include a history of cancer within the last 5 years, any present cardiac conditions, high or low blood pressure, skin conditions, eczema, psoriasis, things like that. If someone is currently pregnant or menstruating, if someone is taking blood thinners, if they have any present acute conditions such as fever, illness of any sort like that, circulatory issues, any sensory loss, or if they're wearing any lotions or oils, we need to wash those away before we apply the electrodes. And then also for E-stim specifically, we want to make sure to not apply electrodes directly on piercings, and we do not want our patients to have a pacemaker. So really make sure that that one's cleared up. So in order to set this treatment up for our patients, we want to first wash the skin with soap and water before we apply those electrodes to the skin, in order to decrease impedance or resistance to allow for better patient tolerance to treatment, and which will also help our patients to tolerate a higher intensity level as well. So a patient should feel that buzzing or tingling with masking at acute pain according to the gait theory. And then we want to adjust the intensity till we see a muscle twitch visibly and then back off a little bit within patient tolerance. So essentially we want that sensory level stimulation. For chronic pain rather, we should visibly see that muscle twitch per that endogenous opiate release theory, or pounding out those endorphins, as I said. And so essentially we're going to the muscle twitch and staying there within that patient tolerance. If we need to back off just a little bit, if it's too intense, we can just turn that down a little bit for them. So you can store your electrodes in like a little bag that they come with. You can purchase them at like a medical supply store or on Amazon rather. And then we also want to make sure we are not placing electrodes onto open sores or any broken skin, and making sure that there's enough space between each electrode, along with using the proper size given the area we will be treating.
Alright, so now we are going to show you how to apply all the information that we just showed you in the previous section with our TENS unit and applying it to lower back pain.
All right, so before we get started, we want to assess the skin. We want to make sure everything looks good. So what I'm going to do is I'm going to roll up her shirt. I'm going to make sure that there's no irritations, there's no scarring or anything like that, no any scrapes, scratches. Once we assess that the skin is all good, we'll take our rag and we're going to clean the area that we're going to be treating. This helps the pads make good contact with the skin. We're going to pull out the pads and we're going to stick them on. Since we're treating low back, we'll put one right here. Put one just on the other side right there. If we were treating a smaller area, we would be using smaller pads. But because we're treating the lower back, it's a bigger area, so we're going to be using the 2x4 pads. Alright. The treatment we will be doing to Caitlin here, is on the TENS unit. We don't crisscross these because it's not an IFC setup, so we're not using a quadrupolar setup. We're actually using a dual bipolar. We could set these up to crisscross, but it still would be considered dual bipolar because they're not interfacing with each other. They're just crossing. But for the purpose of our treatment, we're just going to set them up to run along the muscles, run along the paraspinals. So we make sure the pads have good contact with the skin. We check the skin. We connected the pads to the leads. We're going to connect the leads to the machine. On the machine, we have our 2 ports for 2 channels, channel 1 and channel 2. I'm going to connect the left side into channel 1, and we're going to connect the right side into channel 2. At this point, we can go ahead and get started. First thing we want to do is we're going to turn the machine on. On this TENS unit, called the Intensity Twin Stim 3, there's 2 settings, or there's 2 modes. First one is TENS, the other one is EMS. We want to make sure we're on that TENS. Next, what we'll do is we'll press the S, and it has 4 subcategories of TENS. It has burst, stands for the B, N for normal, M is modulation width, and M1 is modulation rate. We actually want this to be on normal. We'll press the up arrow on channel 1. You can use channel 2 if you'd like, though. After we press normal, we're setting the time. The clock is blinking, so then we can set the time. You would want to set it between 20 and 30 minutes. We can set it for 15, but anything lower than that, we're really not going to get a desired response. So we'll go and set that to 20. With the S, switch us off. Now we're going to pulse width. For acute pain, we're running a shorter pulse. So I'm actually going to leave that on this. I'm actually going to increase that to the 100. And then next, it's going to allow us to set the pulse rate. This is where we can decipher if we're doing acute pain or chronic pain. If we are doing acute pain, we can leave it at that 82, because acute pain is going to be anywhere between 80 and 150. I'm going to go ahead and set this to 100. If we are doing chronic pain, we take this and we set it down anywhere from 1 to 10. The difference between the two is one is going to use the gate theory. Acute pain is going to use the gate theory to kind of give that buzzy feeling, because we're trying to treat acute pain. And then the 1 to 10 is more for chronic pain. It's going to start pounding out the endorphins using an endogenous opioid release to help treat pain. But we're going to have her set up on the acute setting. After that, we can go and raise up the intensity. Are you ready, Kaylin? All right. I'm going to go ahead and set her left side. Kaylin, I'm going to go ahead and raise that side up. You let me know when you feel it, okay? You feel it? All right. So at this point, we go ahead and increase it. We increase it till we see a muscle twitch, and then once we see that muscle twitch, we go ahead and back down, or until the patient says, "Hey, that feels pretty good. I don't know if I can tolerate any more than that." Then we want to keep it at that. It's more so for the patient's comfort. Okay. How you feeling, Kaylin? I said that that's tolerable. We didn't get a muscle contraction. Now I'm going to go ahead and set the right side. You let me know when you feel it, okay? Okay? All right, I'm going to go ahead and go up. Look for the muscle contraction. You let me know when you let me know when it's at a good point. Okay. All right, so we have Kayla set up. We didn't really reach muscle contraction, but we did find a point to where she thought that was enough. What's up?
We can go up if I can just do it as well.
All right, she said we can go up. Okay. At this point, we would go ahead and leave it where it's at. And we had set this for 20 minutes. And so she would be on this for 20 minutes. It starts once you start increasing the time. And then as you can tell, we had talked about the electrode setup that I have here. The electrodes are not placed too close together. So too far apart, we end up hitting tissue that we're not trying to intend to hit, because we're going in deeper. And too close, we may not be hitting the tissue enough, or if they're touching, they can arc and cause the patient some harm. Okay. And that is how you use the TENS unit.